It is 9 in the evening. The last patient left hours ago. Dinner is over. And a good clinician is still sitting at the kitchen table, working through the notes from a full day of care. This is the part of the job no one trained for and no one bills for. The quiet hour after the work is done, spent writing up the work that was done. An hour a night, 5 nights a week adds up to something heavy. It is one of the real reasons people cut their hours or leave the profession they love. I am Annie, and over the next few minutes I want to show you a different way to close the day. Not a faster typewriter, and not a scribe that only hears the room. Something that understands the whole patient. Let me take you from an evaluation all the way to a signed note, and show you why the difference matters. For years, clinic software has treated the clinical note as a transcript. Capture what was said in the room, save it, move on. And to be fair, turning speech into text is genuinely useful. But it was never the hard part. The hard part is everything the transcript forgets. The visit 3 weeks ago. The diagnosis. The plan of care you agreed on together. The injury date, the funder, the referring physician. A note that only knows the last 10 minutes of conversation is starting from 0 every single time. So we built Clinicmaster's AI charting and Scribe around a different idea. Instead of documenting the visit, it documents the patient. Every draft it writes is grounded in that patient's whole record, not just today's words. That one shift from the visit to the patient changes what the note can be, how much time it saves, and how much you can trust it. Let me show you what that context actually is. When we say patient context, we mean something specific. Think about what a great clinician actually holds in their head when they sit down with someone they have treated before. They remember the prior visits and how the patient responded. They know the medical history and the diagnosis, including the primary, secondary, and tertiary codes that shape a claim. For an injury case, they know the date it happened, who was funding the care, and who made the referral. That web of detail is what makes a note accurate and complete. It is also exactly what gets lost at 9 in the evening, when you are tired and reconstructing a busy day from memory. AI charting reads all of it. Before it writes a single line, it pulls the relevant pieces of that patient's record into view. So the draft you get is not a generic summary of a conversation. It reads like a note written by someone who has known this patient for months. Because in a sense it has. Here is how it holds all of that, in plain language. The first piece is retrieval. When you ask for a note, the system searches this patient's own record and brings the relevant history into the draft. It is grounded in the chart, not guessing from thin air. The second piece is memory. You can keep the conversation going. Ask for a change, add a detail, refine the wording, and it remembers what came before instead of starting over. This is the same principle that makes any good assistant useful. Relevant context, plus memory, beats raw model power on its own. And it runs on enterprise language models, Azure OpenAI, and Google Gemini, with the retrieval and memory built specifically for clinical work. The technology matters, but only because of what it lets the note become. So let us actually build one. We are in a patient's chart at an evaluation. You have 2 ways to start, and both happen right here inside Clinicmaster. You can dictate. Talk the encounter through in your own words while it is fresh, and the built-in speech-to-text captures it. Or you can type, if that is how you think best. There is no separate app to open, no recording device to manage, no copying and pasting between tools. You work the way you already work. The only difference is that this time, you are not also carrying the whole note in your head. You are giving the system the raw material, and it is about to do the heavy lifting. Now you choose what you need, and this is where the patient context does its visible work. Pick a session note. The draft streams in live, and you read along as it writes. Structured in your clinic's own template, not some generic shape. It is already filled with the right history and the right details, because it read the chart first. Watch how it flows into the fields you actually use. Nothing about it feels foreign, because it was built from your patient and written to your format. What would have been a blank page at 9 in the evening is a complete, familiar draft in front of you during the visit. And the session note is only the beginning. When we talked to clinics, they kept telling us the note is not where the hours really go. The hours go into everything around it. So the same engine, drawing on the same patient context, drafts 9 kinds of documents: session notes and case summaries, plans of care, letters to a physician, an adjuster, a case manager, or a specialist, PDF forms and web forms, email and text messages to patients, and an interactive chat when you just want to ask something about the record and refine it together. One place, one source of truth, the whole documentation workload. Not just the visit note, but the letter, the form, and the summary that usually eat your evening. Now, the moment I say AI, a fair question comes up. Can I trust what it wrote? We designed for that from the first day, because a note you cannot trust is not saving you time. It just means you have to reread every line. So the model is told to use only what is in the chart and the conversation, with a dedicated anti-hallucination instruction. And creativity kept deliberately low. It is built to stay close to the record, not to embellish it. You can tune that setting for each practitioner and set how long transcripts are kept. Good clinical AI is not about being clever, it is about being grounded and staying in your control. Which brings us to the most important step of all. You are always the author. The system only ever produces a draft. You read it, change anything that needs changing, and you sign. If your clinic uses peer review, you can route it for a second signature first. And here is the line that matters most. Nothing saves to the chart on its own. It waits for your approval every time, and every sign-off is recorded with your name and the time. The AI does the drafting. You keep the judgment, the accountability, and the final word. That is not a limitation. That is the whole design. So step back and look at what this actually changes, because it is more than a faster note. The first thing you get back is time. When charting happens during the visit instead of after it, the evening belongs to the clinician again. That is not a small perk. It is one of the most direct ways to protect the people your clinic depends on. The second thing is better care. When every note starts from the full story, the small details are less likely to slip, and the record stays complete and consistent, visit after visit, and across every location. And the third thing is a healthier business. Complete, accurate documentation is what supports clean coding, faster billing, and letters and forms that do not come back. Time, care, and a cleaner set of books. All from the same decision: to document the patient, not just the visit. That is AI charting and Scribe. Not a scribe that only hears the visit, but a documentation partner that reads the whole chart, writes in your own templates, and leaves you fully in control. The best way to feel the difference is to see it on a real patient with real history. Book a 3-minute demo at the link below and let us show you what your evenings could look like.